understanding and for their civic consciousness in this matter. You can see from the number of cases why we're taking these actions. We are responding to science and data. There's no politics here. The health commissioner and health officials advise us.
Dude, that's crazy. In New York, that's crazy.
The number of cases is
doubled.
way up. The number of cases is up because we're taking more tests. But the numbers are going up, hence the increased actions to reduce the spread, the density reduction. You see total positive cases 2,300, new positive cases 1,000. You see the number of counties that now have cases spreading, just as you see it spreading across the United States of America. This is just a metaphor.
Yeah, that news is going to affect Wall Street. That's going to affect how things are going to stay open.
Tests has gone way up. We've now tested over 14,000 people. That's a dramatic increase. And again, that's why you see the number of positive cases going up. We have the highest number of cases in the United States, again, by a significant margin. We're now about double the next state. I don't know how much of that is due to our increased testing, but we are a more dense environment. We have more people than Washington State. So science would dictate, mathematics would dictate that you'll have a higher rate of spread. Current hospitalizations are 549. Again, that is the number we watch because that's the number that are flowing into the healthcare system. That's the rate of cases flowing into the healthcare system. 23%, we had 20% yesterday. We had 14% last week. So the number of hospitalizations is going up. And again, this is all about the capacity of the healthcare system. And it always has been. Again, perspective. I understand the anxiety. I understand the fear. You look at the pictures on television, empty grocery shelves. It's easy to get caught up in the emotion. But you also have to remember the facts of the situation, right? And the facts are still very clear. We know what this virus does. We know who it is. We know where it lives. We know what it does to people. It's been tracked since China.
But we don't know the baby daddy.
Cases have been tracked.
That's the problem.
8,000 people have passed away. 80,000 have recovered. 113 are still pending. We even know what it's done in the state of New York. Of the numbers we've seen in New York since it started, 108 people have already recovered and been discharged from the hospital. The first case we had in New York, which was the healthcare worker and her husband who returned from Iran and tested positive. She never went into a hospital. She was at home, quarantined. She has now been recovering at home. She actually took a second coronavirus test and tested negative, okay? So 39-year-old female came home, was at home, was on quarantine, recovered. 2 weeks later, tests negative, which means she has resolved the virus in her body, right? And now tests negative. And as we've said, 80% of the people.
So watch this SPY in the dollar here.
She was never hospitalized.
Oil in China have came up. Everything's level. They're waiting for something.
That's what people have to keep in mind.
Wait for Trump. It'll probably be a Trump pump and then dump afterwards. But this is wild.
It's a public health.
Everything's low-key just stopped.
But more than that, I'm telling you, worse than the virus is the fear that we're dealing with.
BFYT is getting pumped by Citron. Mr. Hitch just posted it.
Quarantined. I'm going to be locked out. They're not going to allow me to leave my house. I better stock up on groceries. That's not going to happen. It's a deep breath. We know what is going to happen here. People will get ill. They will resolve. People who are vulnerable, we have to be careful. But the panic and the fear is wholly disconnected from the reality.
Yeah, I don't like the BFYT.
The only
But
way I
that's-
know
that's
to
news if you guys wanna
communicate
look into
is
it.
just what I experience in my own life. And I get those calls every day. And people are just disconnected from the reality of the situation. One of my sisters called me yesterday. I have to have my daughter tested for coronavirus. Why? She has a fever, she's sick, she has flu-like symptoms. No, not that we know of. Did she travel to a hotspot? No. I said, then there's no test, and there's no reason for a test.
Is Trump on?
Leave her home, help her, be careful that she doesn't infect you.
We're coming down. Get ready for the halt.
Can I just
She'll feel better, and she'll get on with it. The one thing I said to my sister is, don't let her go near mom.
Yep.
It's my mother.
That's how I haven't even been able to see.
My
I said
mother's
I
in a
agree.
different situation.
I miss my mama.
Again,
I love you,
senior
Mom.
citizen,
I know you don't watch YouTube, but I love
senior
you.
Citizens, compromised immune system, underlying illness. I said, don't let her go near mom. Otherwise, treat her as if she has the flu. Well, what do? What's self-quarantines? Well, self-quarantine is what we used to do when somebody had the flu, right? My father would say, go in the room, stay there until you feel better, right? That's crude self-quarantine. Don't get infected, stay away, throw things away, use hand sanitizer, etc. That's the reality of the situation. I get the drama, I get the anxiety, but all in moderation and all in connection with the facts. Questions, comments?
A few details. Essential services, does that include like building supply stores like Home Depot, Curtis Lumber? When does this order take effect? And then for the doctor, obviously healthcare workers are exposed, they're gonna get sick, they're gonna resolve. If you've been 14 days and you're resolved, do you get to return to the healthcare workforce? So I guess Governor, start maybe.
Yeah, Jimmy, I'll answer your question, but I forgot one thing. I want to show you the ventilator. Our main scramble now is for ventilators, and everybody says, well, what are the ventilators? What are the ventilators?